If you've been a stay-at-home mom or you've been in and out of the workforce, you didn't have a big career, and you've always been on your husband's work insurance. Now, this is gender neutral, so it could be the other way, but let's use my scenario that I've always been on my husband's work insurance, and so have our kids, right? But now my husband, he's a little bit older, he's turning 65, and he's going to Medicare. Can I go with him? Can my kids go with him? No. Now, I qualify for Medicare off of my husband's work record. If I've never worked, I've been a stay-at-home mom and I've never worked and paid into Social Security and Medicare FICA taxes, you've got to pay them for 10 years, then I didn't qualify for Medicare on my own work record. I qualified by virtue of the fact that I'm married to my husband. I'm a qualified spouse. He worked at least 10 years. So I'm qualifying for Medicare off of his work record, but I'm not eligible to go to Medicare with him. He's going because he's 65. I can't go until I'm 65. And my kids, same thing. They can't go until they're 65. So what happens? What do I do? You have to buy health insurance for people under 65. And in this country, it is called a lot of different things. Affordable Care Act, healthcare.gov, ACA. I call it Obamacare. That's, I think, one of the most popular names because it came in under President Obama. And it's the law of the land. There's no private health insurance for people under 65 other than Obamacare. So I will buy Obamacare until 65, and I can put my kids on it up until they're 26. They could be on my family plan. Now, when I turn 65, then my husband and I are both eligible for Medicare. Then there might be some strategy there where we both get the same Medicare supplement plan because a lot of plans give a discount. They call it a spousal discount, a married discount, a household discount. But they can give you a pretty hefty discount, 5, 6, 7, 8, 9, 10, 12%. It varies based on what plan you buy, what state you live in, and of course it varies year to year. But there are plans right now that if my husband and I both bought the same plan, we could each get a 12% discount, a married discount. So that's something to consider when I said that you're uncoupled at retirement age, that you might recouple at retirement age. But a lot of people don't. A lot of people, he does his thing and she does her thing because they have different doctors. They have different things, that medications they're taking, things that worry them. And even though they might share the same budget because they're married, they have different feelings about insurance and different feelings about doctor. It seems like it's really common that the man will go with Medicare Advantage and the woman will go with the Medicare supplement. So like I said, people couple up during work insurance and they uncouple at retirement, and they might recouple or they might not. They might do their own thing. You and your husband share a budget, but you don't share the same health concerns, the same medications. If you have more questions, go to our website, themedicarefamily.com. Or if you get our free Social Security and Medicare cheat sheet, when you download that, that will subscribe you to our annual, weekly, monthly, we kind of move it around, it's not really regular, newsletter to get you ready for retirement. If you like this video, you might really like this video. Check it out. And we'd appreciate if you subscribe to our channel so you never miss a great video. We put out one every week. Check in the description below this video for a link to our cheat sheet on Social Security and Medicare. And you can also give us a comment if you have a specific question. Always feel free to call us or email us at the Medicare Family.